Good morning, dear students. Today we have discussion on anticonvulsant drugs. What is convulsion? Convulsion is a medical condition where the body muscles contract and relax rapidly and repeatedly, resulting is an uncontrolled shaking of the body. Now, what is seizure? Seizure is any clinical event caused by the abnormal electrical discharge in the brain. Now, what is epilepsy? Epilepsy is a central nervous system disorder. It's a neurological disorder in which nerve cell activity in the brain becomes disturbed. It causes seizures and periods of unusual behavior and sensation and sometimes loss of consciousness. What are the characteristics and symptoms we have seen in case of epilepsy? Sometimes loss of consciousness, it depends on the type of the epilepsy. Anxiety and stirring and weakness of the muscles spasm and contraction of the muscles, jerking and shaking, trembling of the body parts. Epilepsy is a disorder marked by the disturbed electrical rhythm of the central nervous system, and there are certain types of epilepsy, localized and generalized. In case of localized, a particular part of the body is get jerked or shaking is seen there, and in generalized epilepsy, it's also called the grand mal epilepsy. In this, the body becomes unconscious. Now, the drugs which provide action by different ways, these drugs enhance the activity of GABA. GABA is a inhibitory neurotransmitter in the cerebral cortex, and these drugs also inhibit the sodium channel and the calcium channel function. Sodium potassium channel is responsible for the nerve conduction, and the calcium channel is responsible for activation of muscles contraction. Calcium acts as a second chemical messenger. It activates the actin and myosin protein for muscles contraction. Now, the definition of anti-epileptic drugs or anticonvulsant drug is the drugs which are used in the treatment of convulsions, seizures, and epilepsy is called anticonvulsant drugs. These drugs are also known as anti-epileptic, anti-seizures, and anticonvulsant. Phantoin, carbamazepine, valproic acids are the common example of anti-epileptic drugs. The actual mechanism of action is still unknown, but scientists believe that the drugs suppress the seizure by depressing the cerebral cortex in the brain, and it enhances the activity of GABA. The full form of GABA is GABA amino butyric acid. It is a major inhibitory neurotransmitter in the brain, and also these drugs block the voltage gated sodium channel to block the conduction of the neuron, because epilepsy is associated with the axis firing of the neuron, which is totally uncontrolled. That gives the uncontrolled movement of muscles, and it produces jerking and trembling of the body parts, and it is not in control. It's a normal phenomenon. We can control our muscles, but in case of epilepsy, body becomes uncontrolled and movement becomes uncontrolled, and sometimes patient becomes unconscious, and sometimes we see a particular part of the body is constantly jerking or getting vibrated. Now, the classification of anti-epileptic drugs, it is based on the chemical nature of the basic molecule or the derivatives. Barbiturates, example is phenobarbital and mephobarbital. Hydatoin derivatives, example phantoin, phenylethyl hydatoin. It contains the hydatoin basic moiety, and oxazolidine dione derivatives, example trimethadione and paramethadione. Succinamides, phensuccinamides, and metsuccinamides. Benzodiazepines, diazepam and clonazepam. GABA analogs, which is progabide and tagabine. So these are the drugs which are commonly used in management of epilepsy. In this lecture, we have seen the definition and the symptoms of epilepsy, and the common drugs we used in management of epilepsy. Thanks for watching this video.